board for hip hop and R&B. This is the B2C team. My name is Jenny Boom Boom. DJ Meechie's here. Hi, Meech.
Good morning.
And today we're talking to Dr. Eleck, one of our favorite people from Wheeler Clinic. How are you doing there, darling?
Doing pretty darn good. How about you?
Good. So we are in flu season.
Mm-hmm. Oh, we are.
So are you seeing a lot of cases of flu?
Yes and no. I know we are definitely seeing flu in Connecticut. I feel like we aren't seeing quite as much in the office as I would have expected, but it's also a lot of offices, including ours, are screening. So patients with fever and cough are being encouraged to do telehealth appointments instead of coming in person. And I wonder if some of those patients are just not coming in.
Right. Yeah. So, I mean, I know that last time we were all together, you really were trying to encourage Meechie over there to get his flu shot this year because it's so important.
Yes.
So, Meechie, did you get your flu shot?
Dr. Becky Eleck, I failed you. I failed you. I'm sorry. I have not gotten my flu shot yet.
Well, you know what? Maybe I'm the one who failed because I didn't convince you.
No.
I'm really glad everybody's owning their responsibility today for the situation. It's good.
You got to be honest, you know. But
it's not too late. You
Okay.
still got time, man.
Okay.
Yeah, and you can go to the Wheeler Clinic and see Dr. Eleck and get the flu shot.
Right.
You sure can. We're right here in Hartford at 43 Woodland. That's where I am right here today.
Yeah, I mean, I had a flu shot and I survived. Like
That's
my kids
good.
had flu shots, they survived. Everybody survived in my family. We all had flu shots because, you know, the reason why, because of COVID, we really had to be careful with our health this year, especially, but also just correct me if I'm wrong here, Dr. Eleck, because you're the doctor and I'm not. We don't want to take up beds because in the hospital with the flu that might, you know, be needed for COVID patients. Am I right in saying all of that?
Yes, ma'am. And we don't need people going to the ER if they don't need to go to the ER. My kids got their flu shots. I went with them. We go to a family practice office. So I got my flu shot first. They watched it and then they got theirs.
Yeah.
And I think it's a good idea. Everybody should be getting them.
Right. Yeah.
Everybody older than 6 months.
So, you know, should you be worried about the side effects of the flu shot, Dr. Eleck? Because I feel like that's what Meechie's worried about.
Honestly, there aren't too many side effects. I think sometimes people get a little bit of an elevated temperature. They feel a little run down for a day or two afterwards. They shouldn't be getting a fever. But that just means that your immune system's working. And we want our immune systems to work and to rev up and to build up antibodies against the flu so that it keeps us safe and healthy.
Yeah. So that happened to Vic, my other half. And boy, was he a baby about it. But he, you know, he had a little run down situation the next day. He blames it on the flu shot. He's never had a flu shot since he was like a little kid.
But he got one.
But his doctor recommended it. So he had one. And
That's awesome.
He's still okay. You know, he survived. So he, you know, Meechie, I really think you should get it.
Yes. I will figure my life out soon.
Meechie's a conspiracy theorist, so I think he thinks like they stick something in you. You know, it's kind of like the Matrix or something. Like something's going on, you know, with the government or something. Do you want to put him at ease about that, or do you choose not to speak on that, Dr. Eleck?
There is no GPS tracking device inserted into the flu shot. It is really just, you know, broken up components of the flu. It would take an act of God to reassemble them and give somebody the flu. It's just not going to happen. So sometimes people get sick after they get the flu shot. And if you get actually sick, not just a little rundown, it's because you got it during flu season and you were probably already exposed to something before you got the flu shot and before it had a chance to work.
Right.
Now, for the people that are like me that I guess need to continue to get more convincing, can you just discuss again, like, you know, just more of the benefits of getting the flu shot, especially this season?
First, not getting the flu, which makes you feel like death. So that's a plus. And then my bigger concern in getting the flu is if I were to get the flu, I could pass it on to family members. Some of whom might not carry it as well as I do, patients or people who are elderly, people who are immunocompromised, women who are pregnant, all of those categories, young children, really young children. If people fall into those categories and I were to expose them, I would feel horrible. And I think those are the people that end up in the hospital, end up in the ICU, end up on ventilators. And we do have people die every year from the flu. It is a real thing. And the more we can do to prevent the spread of the flu as a public health initiative, I think is kind of a big deal.
Yeah. I remember we used to watch the news or whatever, and they would say 8 people in Connecticut died this week from the flu, and it would really scare me because, that's a lot of people. But now we're talking a lot of people dying daily from COVID-19. And the holidays are coming up, and, there's folks like me that have, older kids that live in other states. There are folks like me that have older, seniors that my mother is she's 90 years old. We want to spend the holidays with our family. What's your recommendation this year, Dr. Eleck?
It's gonna be hard. It's gonna be a different Thanksgiving than we're all used to. That whole idea of everybody gathered around one big table and eating, and now you picture it and it looks funny, but with no masks on next to people that they haven't seen in a long time is kind of a bad idea. There's a few versions of a meme going around talking about big gathering at Thanksgiving, funerals for Christmas.
Right.
And that's about the time frame where things would land if people were to get sick at a Thanksgiving dinner. So that's a powerful image, if you will. So I think outdoor gatherings, I know my family is planning on, we're doing a much smaller gathering, but we're going to bundle up and we're going to make s'mores at my mom's house. We might go for a little walk around the neighborhood. I think if you are looking at getting together with people, you want to make sure that you try to keep it to your usual bubble, that bringing in people from out of state, maybe you can connect with them over Zoom, or if you really want to see them outside, but that gets kind of complicated because then where do they sleep if they're coming from far? So maybe those are situations that you want to avoid. But it's definitely different. And I think of it as a mom of small children. I want to make sure that my kids have memories and that they have positive memories, and we're putting a spin on it. And that's why we're doing s'mores, just to make it a little bit different. And this will be the year that we didn't do a regular turkey dinner. We got together and had s'mores. But I've talked to a number of people that are doing either outdoor dinners or just appetizers outside. We want to try to avoid gathering around a table without masks on.
Right.
Yeah. Okay, so getting back to my own situation, my mother's in Rhode Island, and like I said, she's 90, and we invited her to come and stay for the week, and she turned us down, which was fine because she's like, it's just too dangerous, right?
Yeah.
And so then we have another daughter that's older that lives in New Jersey, and she's going to have a COVID test within 72 hours of coming. Is that safe, or is that not safe to have her here?
It's safer.
Okay.
I think in every scenario, we're looking at what is the lowest risk. The lowest risk would be to just stick with your household.
Right.
If people are getting negative COVID tests and avoiding any other possible exposures, then that might be better. That's probably medium risk. And then the standard Thanksgiving dinner would be a high risk.
Okay. Yeah. Just because we've all also decided to quarantine 2 weeks out from Thanksgiving, meaning
That's smart.
we're working, but nothing else. We're doing nothing else socially. But a lot of places, a lot of people, they're saying, do not get together. Like, this can be the year that you Zoom. So, because this is pretty scary stuff.
It definitely is. And I think quarantining right now, or acting like you're quarantining, is definitely a great idea. And frankly, with the numbers in our state and us being in a kind of red zone as we are right now, and the COVID rates going up, that's a good idea regardless of the holiday.
Right. So are you what are you seeing as far as your patients when it comes to COVID-19?
We are doing a lot of COVID testing. We have active COVID testing going on at 855 Lakewood Road in Waterbury, at 43 Woodland in Hartford. And then we're in Bristol at either Bristol Eastern or Bristol Central, testing at their high schools during the week. And we are seeing a lot of people lining up for testing and a lot of people coming back positive. And there's quite a few people who are really coming in and they've got headaches, they've loss of taste, they're just feeling run down, and they're not super sick, at least not yet. And they're people who are not as sick are probably at more risk of not taking it seriously and spreading it to other people. So it's something to think about. But there are people who get a milder illness, and then there's the people that are filling up the hospitals right now. And we're seeing a lot of healthcare workers that are struggling and essentially burning out because there are that many people in the hospital right now.
Wow. So Meech, have you had a COVID test yet? Because I haven't had one.
No, I haven't had one yet.
Yeah. So talk to us about the process of getting the test. I actually had thought of getting one also prior to Thanksgiving. If I was going to see my mother, of getting one, because you said before that the Wheeler Clinic, you're offering kind of a pain-free one at this point, which is great.
Yes. So first of all, there's two types of tests. There's the rapid test, which is the antigen test.
Yeah.
And there's the slower PCR test. So a lot of the schools and the state requirements and a lot of employers are requiring the PCR test. It takes a little bit longer to get the results, anywhere from 2 to 5 days. And those are the ones that we're doing as the PCR tests. We are doing what's called an anterior nasal swab. So it's not unlike picking your nose, that the nurse or the medical assistant or whoever's doing the testing will actually observe you while you swab yourself. That swab doesn't have to go all the way up into your brain. It's not a nasopharyngeal swab. It's a different kind of swab, and it just gets essentially the boogers in the front of your nose, both sides. So it is relatively painless. We have small children coming in and their parents are able to swab them. The babies don't necessarily like something going up their nose, but it doesn't seem to really bother them, doesn't cause much for bloody noses or anything of that sort. There are certainly places around that are also doing the nasopharyngeal swab. That's just not the swab we're using.
So, I mean, we're just seeing this thing continue to spread. I mean, we talked a few months ago and you predicted that this would happen. I mean,
yeah.
Is it happening at about the same rate you thought it would?
Yes and no. I mean, I guess I never put numbers to it, but I definitely was concerned that as things got colder and people started gathering inside, that we were going to see more numbers go up. And I think back to Halloween and my social media feed, and it was full of people having parties indoors with no masks and lots of alcohol. And all of that, anytime you add alcohol, social distancing goes out the window.
Right.
And people were having a great time. And now we have numbers that are skyrocketing and with no evidence of peaking.
Now, do you feel like, I guess just, I don't know, like we're getting, I guess, ahead of the virus in a sense of like knowing exactly what it is? I mean, you see these announcements with these vaccines that we, possibly have and stuff like that. Or do you feel like, do you still feel like it's still early? Or do you feel like, we're understanding it more, or maybe this thing is growing, this thing is evolving? Like, how do you feel about it?
I feel like we understand it pretty darn well. We know that masks work. We know that hand washing and social distancing works. We also happen to be humans, and we've been doing this for 8 months, and people have COVID fatigue and they want to see their friends and loved ones. And even though we know that these really simple things work, people aren't doing it. Yeah. And to some of that, I think there's a lot of mixed messaging in the media, which is why I think we need more medical providers and scientists to have platforms and to speak loudly, because it's not that complicated. It's masks, it's social distancing, it's hand washing. That's pretty much it. And if we as a society decided that we were going to hold to that, I think this could potentially go away. But I don't see that being embraced on a widespread level. Right. And especially with the COVID fatigue and people deciding that, it's cold out and they want to get together, and having parties and the super spreader events, if you will. Connecticut's making national news for super spreader events. And as all of that goes on, then we're just going to see it go up until it just keeps going up.
Yeah.
So I'm sorry, go ahead.
At some point, I think having a vaccine will make a big difference. But I don't anticipate a vaccine that's going to be available to the general public for some time.
You're right, like the summertime at least, right?
Yes.
Yeah.
I'm hoping that it'll be available for healthcare workers, for people working in nursing homes and prisons, and maybe first responders sometime in the spring. There's possibilities maybe sooner than that, but it needs to be approved and then mass produced. And so there's definitely challenges.
Yeah.
Right. So do you think that as a country as a whole, we pretty much need to just like take a break and shut down just for a little while in order for this thing to really get flattened?
Pretty much.
Yeah.
I'm not sure. It's interesting because I feel like some businesses have been able to function under really strict sanitary conditions, if you will. There are gyms where they're cleaning really regularly. They're having people wear masks. They're social distancing. And is the spread happening at those gyms? I haven't seen any evidence that it is. There's restaurants that are following the rules and keeping people separate. And I mean, now that we can't eat outdoors as much anymore, it's going to be a bit harder. But I think it's possible to keep some businesses open if they're following all the rules. But I think the bars that have been open, even when we were shut down, aren't really helping. And the businesses that are not choosing to enforce rules, and it's not helping.
So I wanted to ask you a quick question. We were somewhere and we were going in to grab food for the kids, like, do a takeout thing. And they were taking people's temperatures as they were walking in the door. Why are people taking temperatures at businesses? And, we're being told to take our children's temperatures in the morning before they go to school, when that is not necessarily a symptom of having COVID.
I think it makes some people feel better. The DPH hasn't recommended it on a widespread level. I know back in, was it April or May when my kids' daycare opened? Initially, they were told that they needed to take temperatures before kids went in, and then they stopped taking temperatures because they removed that guideline because most kids don't get fevers if they get COVID. And people are generally most contagious before they have any symptoms, before they even know that they're sick. So it makes the people in the restaurant feel better. And my hope is that it doesn't give them a false sense of security, that all those people that are passing their temperature screen aren't also coming in and potentially spreading COVID.
So also, if you're looking in a restaurant window, I'm sorry, I'm just asking for personal experience, and you're seeing that the people that are cooking your food do not have masks on, isn't that scary? Or should I not be scared?
I think cooked food is probably not going to spread COVID. If anything else, the food that you're eating goes into your stomach and there's lots of acid in there, and it's probably lower risk. However, for the sake of their cooking staff, they should be wearing masks.
Right.
Okay. And then my other question, I saw in the news yesterday that mouthwash kills COVID within 30 seconds. Is that true?
Yeah, I saw that too.
I saw that story. I was like, mouthwash, really?
I haven't looked into that study. I mean, maybe for a few minutes. I'm not sure that it's potentially useful.
Okay, because I was like, wow, the mouthwash companies are high-fiving each other right now. Like, yeah, we got to get this on the market.
Their stock price shot up.
It's just like the new thing we have to buy on top of all the wipes and the bleach.
I've heard of some dental offices having you do like specific mouthwash swishes before you come in for dental appointments because they're trying to limit the exposure that their staff is getting. So maybe if there was a mouthwash that, decreased the COVID in your saliva for, a certain period of time, it could be useful for that. But otherwise, I don't know that I see that it's super useful.
So it's not like every time you get home, you're just going to swig some mouthwash because you're going to kill the COVID. Okay, all right.
Take a bath in it.
Yeah. Scope. Yes. So, all right. So getting back to the holidays, which is the real reason. I'm sorry. We just have to ask you all these questions because, listen, you entertain our questions and thank you.
Yeah.
We appreciate it.
Happy to.
We appreciate it. So getting back to the holidays, it's just not a good idea to spend time with family unless they are already in your household or in your bubble, correct?
Correct.
Yeah. Okay.
That's it in a nutshell. It's pretty simple. And definitely this Thanksgiving, this Christmas, next year, hopefully it'll be better. And we need to recognize that this is temporary. This is what we need to do to keep our friends and loved ones safe.
Right.
And next year is going to be different.
Yeah. Well, right. I appreciate your honesty, because I think a lot of people have to hear this, you know. I mean, it's funny. It's like, you know, I want to have, you know, my family around and my friends around, but I also know at the same time that every time I'm going to do something with them, I get agita, and I feel like, you know, I'm scared. I get scared beforehand, and then I'm like, oh, I shouldn't have made plans, or like, you know, it's scary stuff.
And, you know, if you have to cancel at the last minute, eventually they'll forgive you.
Well, I kind of feel like politeness is out the door at this point. Like, yes. I'd be saying to people, like, who were you around? Yeah. I looked at your IG, and who is that? Are they like in their home? Like, what are they doing with their lives?
Yeah.
It's interesting. I saw a graphic recently, which was like who you think your bubble is, and it's you, your kids, your spouse, or whatever, and then who your bubble really is, and it's the coworkers that you eat with without your mask on in the break room, and then all of the people that they have contact with, and like just the circles and the overlapping circles. And a lot of us, even though we think we're being careful, we have bigger bubbles than we realize. So I think the more cognizant, or the more we can pay attention to these things, the safer everyone will be.
Yeah, and honesty is just so important. It really is, just talking about, you know, what your concerns are.
I agree 100%. And also, like, if you start not feeling well and you made plans that maybe you shouldn't have made anyways, but you need to cancel them. Like, right. This is not the time to go into work sick, even if you think it might just be a cold or allergies, because tomorrow it might not be. So I think we need to do a little self-check and pay attention to what's going on in our bodies, and make sure that we're not unintentionally spreading things that are going to make people very sick.
Yeah. Right. And just really quick, because when we were talking about possibly going to see my mom, because where she lives, you know, you have to have a test within 72 hours of seeing her. We were thinking about getting the rapid test, but what is a better test? The test that you're offering, the 3 to 5 day one?
Yeah, the PCR test is definitely more accurate. I know Elon Musk had a tweet that went viral where he had 4 of the rapid tests within like half an hour, and 2 were positive and 2 were negative. But that's the rapid test. It's not super accurate. If it's positive, it's probably more accurate than if it's negative. And no matter where you get it done or why you get it done, it should be followed up with a PCR.
Okay. It's kind of like a pregnancy test. The pregnancy test, it ain't always telling the truth.
Yes.
You got to go to the doctor and get the blood test